Hi, I'm Sarah Robertson and I'm a Youth Engagement Lead at Generation Scotland. Firstly, we would like to say a massive thank you to Research Data Scotland for providing us with funding to improve our engagement in 2023 and also for inviting us along to speak today. So a little bit about a background about Generation Scotland. So we are the largest family health study in Scotland. We started in 2006 and since then recruited 24,000 volunteers across Scotland. We combine questionnaires, health records, genetic information from saliva samples, and this allows us then to build up a better picture about health over time and also maybe different conditions that run in families and how we can prevent conditions and also treat things better. Research areas include mental health, cancer, diabetes, asthma, COVID-19, chronic pain, heart disease and dementia. And what we were finding was until recently, the majority of our volunteers were over 60 years old and had maybe been involved in other health research or maybe were part of the university as well. So we wanted to try and find a way to work with members of community that wouldn't normally engage in health research. And until just the last kind of couple of years, we've been able to include young people within our studies. So prior to that, it was only over 18s that could join. So in 2020, the team at Generation Scotland started to explore how they could include young people in health research. They worked with 283 schools across 32 local authorities and developed the Teen COVID Life Survey, which built up a better picture about young people's lives and the importance of why we need to include young people in health research at a younger age. So why do we need to include young people? So one of the points is that they're underrepresented in research, and often research that's taken place about them doesn't always involve them, and it isn't always actually relevant to them as well. So we wanted to make sure that we were giving them a voice in research that affects them, and also that we recognise their input in meaningful ways, which is where myself and my role comes in with the youth engagement side. So where we are now, so Generation Scotland received funding to try and include an extra 20,000 people in the project. We're nearly halfway there in terms of the numbers, but we still only have 1.5% who are under the age of 18. So we're still trying to look at ways that we can reach those audiences. We've also been working quite closely with young people over the last year as well to change kind of our processes, our sign-up processes, and the funding from Research Data Scotland allowed us to meet with young people and to actually remove some of those barriers so that young people can actually now independently join. Previously, their parent or guardian had to join first, so we've kind of really improved and changed that way. Volunteers can also now join online, so they can join from the comforts of their own homes, but we do still have gaps in terms of kind of sort of our membership from rural communities, our qualities groups, and also young people. So that's really where the Research Data Scotland Fund came in and really helped us to improve how we reach out to these different communities as well, because we weren't going to get that just when we were sitting within the university. We had to make sure we were trying to go out and meet with people. So the overall aims of the fund that we had applied for was what we wanted was to promote the understanding of the use of different types of data and research to a younger audience, and also engage with communities who are not often approached for different research. We wanted to also help people to understand the importance of following health and well-being over time, and also the value of why we need to start at a younger age. We wanted to make sure as well that we were allowing the public a space to inform research moving forward. So the funding allowed us to attend different events and go to where the public were at. So we attended Edinburgh Science Festival for 4 days. We went to Glasgow Science Festival. We had a place at the Royal Highland Show as part of the Change Mental Health stall, which is part of the Rural Mental Health Forum, who kindly invited us to join them. We delivered a webinar at the Rural Mental Health Forum on youth engagement and meaningful youth engagement. We had a stall at Intergenerational Gathering in East Lothian for young people, and also for young people that were care experienced. We had mental health, illness and trauma. We had a presence at Edinburgh University Doors Open Day, and the funding also allowed us to purchase equipment that would increase interaction and encourage engagement in different ways. So while people were maybe doing different arts and crafts activities, we were then having a conversation with them at the same time about what it is that Generation Scotland does, and kind of sort of trying to answer their questions along the way. So we had different arts activities. We had kind of sort of sock challenges as well, where people had to pin socks on washing lines to look at kind of different interactions and looking at kind of sort of speeds and reactionary speeds. We also had kind of different brain hats that people could create, DNA jewellery, and also we had kind of 3D brains as well that people could kind of pick up and look at. The funding allowed us various kind of, sort of different outcomes and impacts, and some of them we hadn't actually expected as well, which was quite nice, you know. So we were able to engage with new audiences, particularly young people. We also increased awareness of health research within communities, but there were other outcomes that we hadn't expected. So staff had also gained experiences in a range of public engagement settings and partnership work, and we were still quite a new team. There's quite a lot of new team members within Generation Scotland, so it allowed them the opportunity to work together more collaboratively. Participants reported attitudinal change, that they have a better understanding of health research and the importance of joining studies like ours, and we were able to remove barriers and change kind of our processes as well. So as well as the sign-up process, we improved our websites. We also created Instagram and TikTok accounts as well. And we've been working with young people as well to kind of sort of shape those changes. The funding has allowed us to be more creative with our resources and the way that we engage with communities. And it's quite small here, but there's a wee kind of sort of snapshot of kind of a word cloud that was done at Doors Open Day as well. So what difference people's found or what their learning was at the different events. And it's always important to hear some of the feedback from people that maybe attended some of the activities. So some quotes here. So I never knew research affected us all in such a positive way and that it can be exciting and fun too. I totally think about research differently now, and that was a young person. I thought it would be boring, but I've had fun and I want to know more about brains. And the last one I really like was I didn't realise that my brain was so wonderful, which is a young person, age 12. And let's hope that it might actually be inspiring them to look into kind of different careers and research as well as maybe joining as a participant. So we'd like to say a thank you to the following people. So Research Data Scotland, colleagues from across the University of Edinburgh within the different teams, Glasgow Science Festival team, Change Mental Health, the Rural Mental Health Forum, LGBT Youth Scotland as well, who kindly promoted our events on their Discord channels, and different kind of youth work partners as well, and East Lothian Intergenerational Gathering, the team there. And thank you so much for listening, and please do reach out if you have any questions. The email address is at the bottom there, and there's a QR code that takes you straight to our page. We'd love to hear from you. Thank you.